Next question. A 65-year-old man is brought to the hospital in cardiopulmonary arrest. So patient is in cardiopulmonary arrest. As the CPR is started, his spontaneous circulation returns. So ROSC has been achieved. Which of the following is the most appropriate maneuver to ensure his airway patency? So guys, patient is post-CPR and the patient is unconscious. Unconscious. So his airway is obstructed. So unconscious patient, airway obstruction is very common. So the question has been asked, what maneuver we will do to make the airway patent? So remember, to maintain the patency of the airway, there are two maneuvers. So for opening the airway, there are two maneuvers. Jaw thrust, head tilt, chin lift. Let us see jaw thrust. For jaw thrust, we keep the head and neck in neutral position, and with our thumb, we open the oral cavity, and with our lower three fingers, both sides, we are doing the same thing, both sides of the face, we lift the jaw or we thrust the jaw forward. In jaw thrust, there is no movement on neck joint. So no movement on neck joint. Okay. Then we have head tilt chin lift. In this, with one hand, we tilt the head backward, and with the other hand, we lift the chin upward. So this also opens the airway, but there is movement of neck joint. Movement of neck joint. So guys, if I have to open the airway in non-trauma patient, I would go for head tilt chin lift. This is the best maneuver to open the airway. But if it's a trauma patient and we don't want any movement on the neck joint, there's a risk of cervical spine injury, then we go for jaw thrust. So in trauma patient, we need to go for jaw thrust. So what are the questions which are asked? Questions like clinical question which I have put in your test, that post CPR, the patient is unconscious, airway is obstructed. Now there is no mention of any trauma. Right? So let us assume this is non-trauma. They will mention trauma if it is a trauma patient. So non-trauma. So what would be the most appropriate method to maintain the patency of the airway? Head tilt, chin lift. If the same patient, it was mentioned trauma, I would have gone for the answer jaw thrust.